pediatrician Dr. Leigh Grossman is here for today's house call. She has a brand new book out. It is called A Parent's Guide to Surviving Daycare Infection, which is, of course, something almost every parent worries about. And we're going to talk a little bit about what's in this book. First off, though, how do parents go about choosing the right daycare?
Well, Sharon, that's a hard one.
I bet.
It is particularly difficult because they have spent years waiting for this precious child,
Yes.
and then they're going to turn this child over to other caretakers. So many will choose a nanny in-home if they can do that, but most of us didn't have the resources to provide that kind of one-on-one, and I'm not even sure that it's the best answer.
Really?
In terms of socialization and ongoing growth and preparation for school. So ultimately, all children are going to end up in kindergarten, preschool, daycare of some design. And my thought on this is that I'm looking for a place that has healthy, wonderful people caring for your children, but also that is adhering to the guidelines that we recommend for infectious disease safety, which
Go ahead.
which include smaller numbers of kids, particularly if they're diapered or they're in infants. So less than 4 kids under the care of one person. You want to know that the caretakers have been vaccinated. You want to know that the kids have been vaccinated. You want to know that their mats are a certain level apart. You want to know that they clean properly. So there are all kinds of things that are outlined in one of the chapters with a check-off list for what to look for.
And right before we went to air, you said it's not necessarily a bad thing. Parents complain all the time. My kid's always sick. Why, why are they sick? And you say that's not necessarily a bad thing.
On the average, preschool children, early elementary school children will have 5 to 7 viral illnesses a year. So that could be stomach flus, it could be upper respiratory infections, colds, coughs, whatever. Minor viral illnesses. Not so minor in the family because everybody gets them and everybody's sick, but minor in the sense that they're self-limited and they don't leave the child with any devastating consequences. And actually what they're doing for that child is developing a normal immune system, which is the reason those of us who are older don't get as many coughs and colds.
Because I think a lot of parents think I got to keep everything so just sterile. Not a good idea necessarily.
I think it's normal childhood.
All right. Well, Dr. Grossman, thank you so much. Where can people pick up your book?
It's available online.
All right. Sounds great. Thank you so much for coming out today.